Hello, I'm Joe Devine, President and CEO of the Kennedy Health System. We appreciate you choosing Kennedy for your healthcare needs. We are here to help you get well and back home as quickly as possible. This brief video will provide important information about your hospital stay. I am sure you will find it worth watching.
Hello, I'm Dr. Marianne Loletta, Vice President for Medical Operations.
And I'm Helene Burns, Kennedy's Chief Nursing Executive.
I'm responsible for the quality of your care while you're in the hospital and your smooth transition for follow-up services after you leave. As a teaching hospital, Kennedy offers its patients an added element of care. While you may be seen by medical students and various doctors in training during your hospital stay, every aspect of your care is directed by your primary or attending physician. Also, because many of our physician groups work in large practices, you may be seen by different doctors each day who are actually part of the same team. Your attending physician may also request the assistance of one or more physician consultants regarding your care. Our medical experts work together throughout your stay with us.
Dr. Loletta is absolutely correct about our medical experts working together. And two things we care deeply about are your privacy and the ability to effectively recover. If you have a concern about your medical care or any other aspect of your hospital stay, please alert a member of your care team. Your safety is the #1 priority for each and every Kennedy nurse, doctor, and team member. This means you may be asked repeatedly for your name, date of birth, and about allergies or medications you take. This ensures you receive the right treatment every time. Safety practices are also used when transporting patients to and from their rooms.
Pain management is also important to us. So if you experience pain at any time, please talk to your doctor or nurse so we can address your needs quickly.
Each day, your nurse will talk to you about your care plan. If you have any questions, please speak up. We are here to help you.
And now we'd like to familiarize you with some important information about your patient room and the way your day at Kennedy may be structured. To begin, please let your nurse know about any over-the-counter medications you take or any prescription medicine you need. If you have brought medications with you, even over-the-counter medicines, please send them home with a family member or ask your nurse to have them secured until you are discharged. It's important that you do not take any medications from home while you're a patient in the hospital. And just as important that you let your care team know what medications you regularly do take. While Kennedy maintains a safe environment, we recommend that you have a family member bring home your valuables and money, or ask that our security department keep these items in a safe until you are discharged. As you get settled into your room, you'll see that you can adjust your bed by using the buttons on the inside of the rails. If you need assistance, just ask your nurse or aide. You'll find a call button located at your bedside. You can press on it to call for help, and a member of our team will respond quickly. Most patient rooms have a whiteboard on the wall, which is used to provide information about the plan of care for the day and your care team, such as your doctors' and nurses' names. New patients are asked to select a contact person who can request information about your condition by phone. This person is given a confidentiality code number so that your family can get updated information about your condition. It's how we can ensure that the information about your condition is provided to someone you know and trust. To use your phone, press the on-off button first, then dial 9 for local calls, which are free, or 91 for long-distance calls outside of the 856 area code. Press the on-off button when finished to hang up. And speaking of phone calls, Kennedy's One Call Does It All program is available if you have additional needs or a special request. Just dial 1111 from your bedside phone and relay your concern to the person who answers. In addition to our One Call service, you can also contact a member of our guest services team to assist you with any special requests you have while in the hospital, such as arranging a clergy visit. Television service is offered free of charge. You'll have your own remote control to operate your TV. Headphones are available to patients in semi-private rooms should the volume become an issue. We encourage a quiet environment to promote healing. Kennedy is Wi-Fi equipped should you or your visitors like to use a laptop computer or other wireless device. Instructions for login are located in areas throughout the hospital. Please ask a member of your care team should you need assistance. Meals are generally served around the same time each day, 8 a.m. for breakfast, lunch at 12 noon, and dinner at 5 p.m. Unless you are on a restricted diet, you will be given menu choice options each day for the following day's meals. Your room has a thermostat that controls the temperature. Please ask a member of your care team to adjust the thermostat to your comfort level. Your room will be cleaned each day. If you have any concerns or requests for housekeeping, please call 1111. Remember, one call does it all. On occasion, patients may need to be placed in isolation for their own safety and the safety of others. If this were to occur, ask your nurse why you are in isolation and what precautions need to be taken. In some circumstances, it is necessary to isolate patients until it can be confirmed that isolation is not required. Visiting hours can vary in Kennedy's different patient units. Just ask a member of your care team about visiting hours for your floor. There are gift shops and cafeterias for your visitors' convenience. Our cafeterias, which offer a variety of meals, are open from 6:30 a.m. to 6:30 p.m. daily. Please note that Kennedy is a non-smoking environment, which means that smoking is prohibited anywhere on the hospital property, even outside the building. This policy is in place for the health and well-being of our patients, visitors, and staff. We want everyone to breathe easy while at Kennedy. Now, let's talk about your day at Kennedy. The registered nurse assigned to your care will frequently assess you and will also administer medications. This assessment continues during the night for your well-being, but please know that we do our best not to interrupt your sleep. Your attending physician or a partner in their practice will visit you daily to examine you and adjust your treatment plan as needed. Your doctor may request daily laboratory tests, such as blood work. Our lab technicians can arrive as early as 5:30 a.m. on some nursing units. Most imaging tests, like routine X-rays, are done in the hospital. Patients are taken to the testing area and returned to their hospital room by a member of our transport team. Every patient is assigned both a case manager and a social worker, though not all patients require the services of either or both. These members of our team help facilitate your care while you are in the hospital, as well as coordinate your discharge plan to achieve the best possible outcome. Your doctor will discuss your upcoming discharge with you. To ensure a safe transition back to home, your nurse will review your discharge instructions with you, then complete necessary paperwork and make arrangements for follow-up care as needed. Your nurse will help coordinate your discharge, a process that can take several hours. Please be patient. We work carefully to ensure you'll get the care you need once home.
We hope this information has been helpful. Feel free to ask questions of your care team members at any time. We're here to help. Kennedy is committed to providing the best care possible, and your feedback lets us know how we're doing and where we can improve. If you receive a patient satisfaction survey, please take a few minutes and complete it and mail it back. If you don't receive a survey, and not all patients do, you can still share your opinion through our website, www.kennedyhealth.org. Welcome, and again, thank you for choosing Kennedy.